Okay, welcome along to our monthly topic of vaginal atrophy. I am talking to Claire Macaulay. Claire, would you like to tell us a bit about what you do?
Hi, Emily. Thank you so much. So, my name is Claire Macaulay, as you said. I'm a doctor. I treat patients with breast cancer. That's my day job. But on the side, my passion, if you like, if you pardon the pun, is around sex science, and particularly around what that means when we become perimenopausal and menopausal. And that's what I do.
Awesome. So, vaginal atrophy, I mean, it's one that people don't like to talk about. People are kind of embarrassed. I see it in the group. It comes up quite often. People go, sorry if this is TMI. And it's like,
Yeah.
it's just another part of your body, and we need to be able to talk about it. So what are we really talking about when we talk about VA?
Okay. So we've moved on a little bit actually, even from using the term vaginal atrophy, because, and that's really important, and that's what we're really going to focus on today, which is because it's not just about your vagina. And I think that's a really, really important part of what we're talking about, is that it's now called, or the way it's terminized is usually the genitourinary syndrome of menopause. So if we break that down, genital, so that's your genitals, so all bits of your genitals, your labia, your clitoris, your vulva, your vagina, all of that. And then the part that I think sometimes gets messed off is this urinary part. So that's your urinary system. So that's your urethra. That's where you pee out of. It's the bit that connects your urethra to your bladder and all of that kind of air, and the muscles of the pelvic floor. So when when people talk about VA, we're really talking about that, essentially that whole bit of you, essentially from between your legs and from your hip bone down. It's all of everything that's encompassed within that. And I think that's really important for people to understand, is we're not just talking about the internals of your vagina.
Yeah, and I think that does often get kind of lost in translation, doesn't it? So what would people start to see as symptoms if they were starting to experience this?
So for the vast majority of women, their very first symptom at all of anything to do with perimenopause and menopause is usually vaginal dryness. Not the hot flushes, not all of the things that we think about menopause. Is actually, if you track back, many women will realize once the penny drops what's going on for them, they'll track back and they'll go, oh yeah. And that's what happened to me. That was my experience. It was vaginal dryness I noticed first of all. And what happens is that because our estrogen levels are dropping, all of those tissues that we've just mentioned, so your bladder, your urethra, all of the parts of your genitalia, are relying on estrogen. And as that estrogen begins to fall, it's almost like they're not being fed. So they're not being fed with estrogen. So those cells begin to die off, they begin to change, they begin to become much more dry, and they don't do their job as well. So they don't lubricate as well and all those kind of things. So that's what's happening. The symptoms that people usually notice are vaginal dryness to begin with, but then we can move on to itchiness, pain, painful sex, all of those kind of things. But usually it's dryness that people will notice first.
So yeah, you mentioned that it can move on to itchiness and then pain.
Yeah.
How bad can that get?
It can be bad enough not to be able to sit down. I mean, I think we need to really understand the levels of discomfort that some women are suffering with. And often, interestingly, when we look at the research, so there's lots of survey research about women and their experience of VA, let's call it VA for the purposes of this. And a very small proportion of them, roughly about 20%, will twig the vaginal symptoms and the vulval symptoms that they have and menopause. So often women are suffering with this issue and not even aware, even if they've got some semblance of awareness about perimenopause and menopause, will not necessarily link the two things. And what that means is that people think that they're broken, they think that it's only them, they have nobody to talk to about it, and they endure really quite significant symptoms. And that, for me, is heartbreaking, because actually it doesn't have to be that way. And it's really important that we start to get women to be able to talk about the symptoms that they're experiencing, because if we don't talk about it and we don't know about it, then you can't do anything about it.
Absolutely. And is it quite easily treated if somebody has cottoned on what's happening and has decided they're going to go and speak to the doctor? And I know a lot of women feel very embarrassed about speaking to their doctor about this, and really, please don't, because it's, you wouldn't be embarrassed talking about your hand, so don't be embarrassed talking about your genitals. It's still part of your body. Certainly, as far as the doctor's concerned, it's just a body part, isn't it?
Absolutely. And I think that's really important. You are not going to tip up at your GP with something that they've not seen before. That's the first thing. We've all got one, 50% of the patients have one. It is a really, really common, it's a really, really common part of our body that as doctors we see all the time. It's just on the other side, it's not something that people are generally used to talking about in their day-to-day life. So please go to your doctor. The first thing is to make sure that that is what it is. So, there are other things which can mimic these kind of symptoms. So the obvious one, particularly if we're talking about itchiness, for example, the common things can be thrush. So because the interior environment of our vagina is changing, the pH of the vagina changes, the bacteria that live in the vagina change as we start to get into vaginal atrophy, and that will carry on. It can mean that the vagina is just a different environment, so bugs can grow there. So for example, you can have bacterial infections, you can have thrush, which obviously is a fungal infection. And the other big one, particularly around itching, is this is a condition called lichen sclerosis, which is an intensely itchy, usually in one area, usually of the skin. Now that's a different thing and needs different treatment. It's much, much rarer than vaginal atrophy, but there would be a particular reason to go and see your GP to make sure that it is indeed that. That would be my first thing, is that we need to know what we're dealing with. But once we know what we're dealing with, then yes, there are options and things that you can do to try to manage that you manage the symptoms that you have.
And what sort of options are there for managing the symptoms?
Okay.
Of specifically of VA, we won't worry about.
I don't think we should necessarily get into the treatments of the other things, because I think that needs people to seek their own medical advice about whether they may have something else and take the advice then that they're given for whatever diagnosis that they're given. But if we're talking about VA specifically, so essentially it is the symptoms come from the dryness. So even if we're not aroused and lubricated, our vaginas are creating a moist environment. Oh, that word, people hate that word, don't they? Moist. Create an environment that is conducive to the cells being healthy and moist and well. As that moisture begins to drop because the cells are not working as well, that means there are numbers of ways we can do to deal with that. We can add back moisture. So one of the common ways of doing that is to use long-acting vaginal moisturizers, which you can get on prescription. But also many women may choose to do self-massage, which is a really beautiful thing to offer yourself. But a lot of women, in my experience, have real difficulty even touching their own genitals. But when we start to work on some of that and we start to bring some self-love and self-care and some acceptance around those pieces, self-massage with things like coconut oil, any kind of oil, usually if you would eat it, you could put it on your genitals, is the way that I look around it. You can use an oil of your choosing. I wouldn't use things like baby oil and Vaseline and those kind of things, but if you can eat it, you can put it on your genitals. So massage can be helpful. Long-acting vaginal moisturizers, which you can get on prescription or you can buy over the counter. And these are types of gel that encourage moisture to stay in the one place. That's really what they're like. They basically coat the lining of the vagina, encourage water to stay, and reduce some of the symptoms that come from the dryness. And then moving up from that again, you then have options of managing things hormonally. So, it is an estrogen deficiency syndrome. It's because of the lack of estrogen. And so there are two main ways to recover that estrogen in that area, which one is HRT that you take for the rest of you may well work for your genitals. And that might take a little bit of tweaking. It depends what your symptoms are. We all know that, HRT is not a one-stop shop or one size fits all. You may need to tweak about with that. You may need to up your estrogen. But even with HRT that's tablet form or patches that's for the rest of us, even with that, about 25% of women will still need something locally in the vagina as well. And I think that's something that's really important to get across to women, is if you're given HRT and it takes away the rest of your symptoms, your hot flushes and insomnia and anxiety and all those kind of things, and you've still got vaginal dryness and pain, then there are other things that you can add in. Equally, if vaginal dryness and pain is your main problem and you don't want to have systemic HRT, then using estrogen locally in the vagina can be really helpful. So it's a cream or a pessary or a ring. So you can have like a ring pessary that's put in that stays, that contains a small amount of estrogen that will secrete it into the vagina. You can use pessaries, which are basically tablets that you put in, or you can use creams. Generally what you do is you load up for the first couple of weeks. You might use it every day for a couple of weeks or 3 weeks. And then most women will find a balance of somewhere between 2 to 3 times a week, inserting estrogen into the vagina that acts locally. Now, the key thing about that is, obviously, there is this constant and pervasive worry about breast cancer and hormones. What we know is that there is no link whatsoever between using your estrogen vaginally and breast cancer. So there is no evidence that there is any link between the two of those. And the reason for that is because the estrogen is absorbed through the vagina, through the blood vessels in the vagina, to the areas locally, and doesn't necessarily get to the rest of us. So it's an incredibly safe treatment. And, and I would encourage women, if they are having difficulty, you do not have to have fanny pain. It's not a prerequisite of going through the menopause. There are things that you can do to help.
Awesome. One last question. Would you advise that women get to know what they look like in their genitals so they can see changing? Oh.
So this, I don't go anywhere without my vulva, Emily, just so we're clear. This is my wondrous vulva puppet. And basically I use it as a way of being able to demonstrate pleasantly in purple velvet to women what they should be looking for when they're looking at their genitals. Now, there are a significant proportion of women who come to work with me who've never looked at their genitals. So the issue then becomes, okay, well, how do I know what's normal? And I didn't know what it looked like before, so what do I know what it looks like now? So let's just do a little bit of orientation about what we see when we're down there, okay? So we have the outer labia here, which are usually covered with hair. We have the inner labia here, which swell when we become aroused, sexually aroused. We have the clitoral hood, which is a little bit of skin that is over the top of the clitoris, and then the glands of the clitoris underneath, which is here, which of course is only the very tiny part of the clitoris that we can see. The rest of the clitoris is embedded within here with legs and bulbs behind this that you can't actually see on the front. And then our urethra, and this is important that women understand this, our urethra, which is represented here by this little rose, is a little hole that you will see between your clitoris and the opening of your vagina, and that's where you pee out of. And for women to understand where that is and why it's important, so you can see why the tissue here and just above that, so there's the tube then that goes from the opening up to the bladder, which sits behind, you can see why all this tissue is also involved in terms of estrogen, and that's why urinary symptoms are really important and can be as crippling, if not more crippling, for some women than the vaginal symptoms. And then we have the vaginal canal and the G-spot that's in here, but the vaginal canal. So just to have a basic sense of what your anatomy is, and yes, absolutely, if you've never looked at your genitals, or if you're worried about looking at your genitals, jump on a call with me and we'll look at your genitals together, because it's a really hugely empowering thing when we start to get in touch with these things. But yeah, absolutely. So never go anywhere without your velvet vulva would be my advice.
I don't think I can top anything with that. I'm just going to have to say thank you very much, Claire. That's been brilliant.
Thank you very much for having me, Emily. Take care.